Hello, everyone, and welcome to our session, Paperless Clinic, 5 Reasons to Take the Next Step Toward Digital Transformation. I'm Erin Head, and I'm a senior healthcare consultant with Iron Mountain. And prior to joining Iron Mountain a little over 3 years ago, I spent my entire career working as a director of health information management in hospital settings as well as physician offices. So, why is it so hard to get rid of paper? If you have visited a US healthcare clinic as a new patient anytime in the last 15 years, you've probably had the experience of being handed a clipboard with a stack of paper forms. You then spend the next 15 minutes or more answering questions about your address, your medical insurance, demographic details, symptoms, and emergency contacts. And of course, you also sign your name at least a half a dozen times on various notices. Then, when you hand the clipboard back, the person behind the desk asks for your ID and insurance card, which they scan into the system. Then the office workers spend another 15 minutes or more retyping the information you just provided on paper so that it is in the electronic record. By now, you've waited at least half an hour before seeing any kind of healthcare provider. And you know that when you do finally go back to a room, the providers will ask you the same questions that you've already answered. And if you're like many patients, you'll probably start to wonder, why did I just complete all of that paperwork in the first place? Wouldn't it have been more helpful to enter the information digitally the first time instead of having to write it and then have someone retype it? Clinic managers are well aware of these inefficiencies, and many have actually taken some steps to digitize their processes. According to the Centers for Disease Control and Prevention, 88.2% of office-based physicians are using electronic medical record systems. Some may have improved the signature process so that patients can view all of the notices and sign digitally. Some have even replaced the familiar clipboard with tablets or applications that allow patients to sign in digitally. But unfortunately, many continue to rely heavily on paper. Why is that? Well, I think it's because old habits are hard to break. Clinics have worked hard to develop and implement processes that comply with regulations. And some of those paper-based processes are just ingrained, or it's just the way we've always done things. In addition, switching to electronic workflows usually requires significant upfront investment to software, equipment, training, and staff time. During the pandemic, clinics were overwhelmed by the number of patients coming through their doors. They were rushing to enable telehealth visits and struggling to keep up with the ever-changing protocol recommendations. Migrating away from those paper-based processes just wasn't a priority. But today, clinics are facing a new set of challenges that truly makes digital transformation absolutely critical. Many healthcare clinics are now part of large corporations that own healthcare facilities in many different areas. While this trend has been ongoing for decades, it has really accelerated in recent years. Many large healthcare systems are facing significant financial challenges. The prolonged high inflation has left consumers with less money in their pockets. In fact, a Deloitte survey found that 28% of Americans say they are less able to pay for unexpected medical costs than they were a year ago. And as a result, some are choosing to forego some recommended care, which affects clinic revenue streams. In addition to that, drug expenses per patient have increased 37% since before the pandemic, and supply costs per patient are up 20%. At the same time, record numbers of healthcare workers have resigned. Healthcare employment alone has declined by 40,000 since March of 2020. And those workers that remain are demanding higher wages, which increases the financial pressures on organizations. And large healthcare systems are hoping that economies of scale will allow them to reduce expenses while providing a high level of care. But in order for that to happen, they need to standardize operations. and they need to rely more heavily on automation. And for many, that means going paperless. So becoming a paperless clinic isn't a one-time event. It's a journey. In fact, most clinics have already started this journey by migrating to EMRs. And some have taken additional steps by scanning paper documents and using optical character recognition, or OCR, to capture data from paper forms instead of retyping everything. Some may have digitized the signature process, allowing patients to sign all of their forms and authorizations at once. But many have still not fully digitized their new patient and sign-in processes. And most still have tens or hundreds of thousands of pages of paper records they're retaining for compliance purposes. So wherever you are in this journey, taking another step towards becoming more paperless offers numerous benefits for your patients, providers, and the organization. So let's explore the 5 reasons for clinics to become more paperless. The first reason is for improved patient experience. So for patients, the biggest benefit of a paperless clinic is a streamlined process. Instead of filling out those paper forms with data that they will need to be typed into the system, they can enter that information digitally themselves. And depending on the process you choose, they might even be able to complete this process before arriving at the clinic. That means shorter wait times, needing to take less time off of work, and less time managing the waiting room. In addition, paperless processes are more accurate than paper-based processes. The office staff no longer need to decipher patient or provider handwriting, and those digital systems are providing the opportunity to double-check data, like addresses and zip codes, to make sure patients are entering them accurately, and that reduces the chance of errors. Storing records digitally also makes it easier for staff to find them when necessary. If a patient calls with a question, staff members can find the answer in the file with a couple of keystrokes instead of having to go sort through those paper files. And ideally, clinics can also give patients access to their own medical records through a secure patient portal. That saves patients time, and it helps ensure patients are engaged in their healthcare in real time. So when implemented well, these paperless processes can also help standardize the patient experience. And organizations that own many different clinics can implement best practices at all of them. And they can use the feedback they receive from patient surveys to improve processes across the organization, which helps improve the experience for everyone. And if a patient goes to a different clinic than usual, they will still have a familiar and reassuring experience that helps them feel cared for. So in short, those paperless processes save patients time and give them a better overall experience, which in turn can help the clinic retain and grow its patient base, putting it on more solid financial footing. The second reason is reduced burden on staff. The impact of paperless processes is even more significant for staff than for patients. Retyping data that has already been written on paper forms and scanned into the system isn't really the best use of an office worker's time. Most healthcare staffers choose to work in this field because they want to help people, not because they are drawn to the data entry. Filing paper records or finding old files is incredibly inefficient. If a piece of paper has been accidentally placed in the wrong place, workers can waste hours or even days tracking down that information. These inefficiencies might seem like small things, but they place unnecessary stress on workers. A 2023 study found that 4 out of 10 healthcare workers are actually considering leaving the industry. The report found that one of the reasons for the dissatisfaction was process inefficiencies in clinics. So compared with the cross-industry average, 6% fewer healthcare workers say work processes allow employees to be as productive as possible. 4% fewer healthcare workers say their managers help remove those barriers to getting work done. And 5% fewer healthcare workers say that the company continually improves how the work gets done. So, becoming more paperless can improve some of those inefficiencies. Now, while it may not be enough to solve all of the morale problems that are plaguing clinics, it's a step in the right direction. And it gives the staff more time to have the type of patient interactions that increase the satisfaction for both the patients and the employees. Our third reason to become more paperless is optimized clinic operations. Clinics often take in records from outside providers, such as hospitals, labs, imaging services, and specialists. And in some cases, these records are still faxed from another facility or delivered as paper copies. And without a system for digitizing this incoming data, clinics are experiencing additional inefficiencies, not to mention the possibility of discrepancies among the various different records or duplication. So many organizations have expanded by purchasing other clinic groups. And as a result, they may often have clinics with different processes and systems in place, which could lead to disjointed data in different repositories. And this poses additional challenges for information governance and compliance. So, with those standardized, digitized workflows, the organization can begin to unlock one of its most valuable assets, which is data. And you can analyze data across the entire network to find insights that can help better serve patients. And it allows the healthcare industry to begin to unlock the benefits of digital transformation that other industries are already enjoying. And most importantly, this digital transformation doesn't come at the expense of personal interaction. Actually, on the contrary, it frees up time for providers and staff to listen more fully to their patients. So by coming more digital, the practice ultimately becomes more human. Our next reason number 4, is opportunities for new revenue. Paper is expensive, and many organizations don't necessarily consider the expense of the space to store paper files. The average filing cabinet actually takes up 9 square feet of floor space and stores maybe about 11,000 pages of documents. And that typically costs about $1,500 per year just in that little storage space, though it could be much more if you're in a high rent location. Now, by comparison, you could store up to 65,000 pages of Microsoft Word files in 1 gigabyte of storage. So that means a 500 gigabyte drive could store about 3.25 million documents. So if that 500 gigabytes is on a single 2.5-inch solid state drive, it would occupy approximately 11 square inches or 0.08 square feet. Big difference. And more importantly, if a clinic reduces the space it dedicates to paper storage, it can reduce its real estate expenses or free up that space to be used as patient care rooms or provide new products and services to the people it serves. When Iron Mountain helped Leahy Clinic become paperless, the facility converted their free space into a new lab. And as a result, the clinic generated $1 million in additional revenue. If your organization has significant space dedicated to filing cabinets, consider how much income you could generate by putting that space to a more profitable use. Our 5th reason to become a paperless clinic is increased compliance. No analysis of healthcare technology is complete without considering compliance. And healthcare is one of the most regulated industries in existence. Failing to comply with the privacy, the safety, and financial regulations can put clinics at risk for hefty fines. Going paperless makes it easier for healthcare clinics to comply and prove their compliance with those relevant laws, such as HIPAA. And when records are digital, it is much easier to control who has access to them. It also provides a documented trail of who accessed the data, when, should it ever be needed for legal proceedings. Clinics are also required to demonstrate meaningful use by promoting interoperability of EMRs to maintain their Medicaid and Medicare funding. So going paperless not only helps ensure that organizations comply with this requirement, it allows them to go further and experience the full benefits intended by the law. So basically, going paperless allows you to do a better job of safeguarding patient information. It makes it easier to spot fraud and abuse, and it helps you improve the quality of care. As a result, clinics comply not only with the letter of the law, but also with the intent of keeping patients safe and healthy. Now let's look at a case study on how Iron Mountain helped Leahy Clinic streamline patient visits and generate an additional $1 million in revenue. Located in Massachusetts, Leahy Health has more than 70 primary care offices with more than 5,000 providers. And the clinic wanted to accelerate their transition to a paperless environment by bridging the gap between their historical paper records and their current EMR system. They turned to Iron Mountain, who helped digitize the vast stores of their paper files and implement those new digital processes for storing patient data. Iron Mountain's scanning service allowed the organization to move paper records off-site and to image those patient records on demand, putting the right information into the clinician's hands at the right time. And as a result of going paperless, Leahy was able to convert their storage space into a new lab, which generated an additional $1 million in revenue. And they were able to eliminate 2 hours of administrative time per patient visit, and that allowed them to reallocate 4 full-time employees to other tasks, and that helped them improve their patient and employee satisfaction. So we know that the future is digital, and our healthcare norms are changing. The remote care is becoming far more common as remote monitoring and telehealth and even telesurgery are taking off. And artificial intelligence is playing a huge role with computer vision systems aiding in diagnostics and machine learning systems providing decision support. Digital technology is transforming the practice of medicine at every level in exciting ways that could allow people to lead longer and healthier lives. So clinics that want to help bring about this future can prepare today by leaving those paper-based processes behind and progressing toward the digital age. And that choice will help improve the experience of healthcare for patients and providers, while also enabling cost savings and new revenue opportunities for organizations. So for more information about the benefits of becoming a paperless clinic, you can visit our Iron Mountain website. And Iron Mountain partners with AWS to offer you a variety of digital solutions like those covered in today's presentation. And they can help accelerate your journey from physical to digital to cloud at petabyte scale. And we collaborate to help you securely access and store your information and find what you need when you need it, to automate workflows for improved collaboration, and to unlock insights with our secure content services platform. So if you want to learn more about becoming a paperless clinic, you can ask your Iron Mountain sales representative for more information. And if you'd like a demo, you could visit our Iron Mountain website at ironmountain.com. And if you'd like to learn more about how we can help before talking to someone, you can also just visit our Iron Mountain website. Thank you.